So today's presentation is on drug abuse. First of all, the overview of what we'll be covering today. I'll be covering unit 1 of the syllabus, that is the problem of drug abuse. What are drugs and what constitutes drug abuse? The prevalence of the menace of drug abuse. How drug abuse is different from drug dependence and drug addiction. Physical and psychological dependence. What are the concepts of drug tolerance? And then introduction to drugs of abuse. First of all, the problem of drug abuse. What is the concept and overview, and the types of drugs often abused? The first question arises is, what are drugs and what constitutes drug abuse? As defined by US FDA, drug, it is a substance recognized by an official pharmacopoeia or formulary, a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. A substance other than food intended to affect the structure or any function of the body. According to the Drug and Cosmetics Act of India 1940, drug includes 4 categories. First, all medicines for internal or external use of human beings or animals, and all substances intended to be used for or in the diagnosis, treatment, mitigation, or prevention of any disease or disorder in human beings or animals, including preparations applied on human body for the purpose of repelling insects like mosquitoes. Second, such substances other than food intended to affect the structure or any function of the human body or intended to be used for the destruction of vermin or insects which cause disease in human beings or animals. Third, all substances intended for use as components of a drug, including empty gelatin capsules. And fourth, such devices intended for internal or external use in the diagnosis, treatment, mitigation, or prevention of disease or disorder in human beings or animals. So according to these definitions, a drug is anything which helps to diagnose or treat any kind of disease or disorder in human beings and animals. It can be a device, it can be the carriers of the device like the gelatin capsules. So all of those come under drugs. So basically what we call medicines are actually defined as drugs by the official bodies. Now next question comes, what is drug abuse? Now all the drugs discovered from nature or whether developed synthetically in the laboratory can exert beneficial effects on human body only if taken under strict supervision and guidance of a doctor. So what is rational drug use? Use of a drug in a specific dose at specific intervals for a specific period as intended for treatment of a disease. So for example, you have a disease, you go to a doctor, that doctor writes you a prescription. That prescription includes a specific dose of a particular drug that you have to take at specific intervals, for example, morning or evening or both, and for a specific period of time, that is probably 5 days, 7 days, 10 days. So that taking that prescription in that intended dose, in that intended interval and that intended period of time is called as rational drug use. Now next comes drug misuse. What is that? It is a use of a drug for a purpose other than for which it was intended. It also refers to use of lower or higher doses, changing the frequency of intake. So for example, if a drug is written to you by the doctor, prescribed to you by the doctor to be taken for 2 days, and you continue to take it for 5 days, that is drug misuse. If it is prescribed to be taken only once a day and you take it thrice a day, that is also drug misuse. Next comes drug abuse. It is a compulsive, excessive, and self-damaging use of habit-forming drugs or substances leading to addiction or dependence, serious physiological injury, that means injury to various organs of the body like kidneys, liver, heart, etc., and or psychological harm such as dysfunctional behavior patterns, hallucinations, memory loss. So all of this comes under drug abuse. It is also called as substance abuse. Now, drug usage of both legal and illegal drugs can lead to drug abuse. What are legal drugs? The legal drugs include all the over-the-counter drugs, the prescription drugs, that means all the medicines prescribed by the doctor, the over-the-counter medicines available from the chemist, as well as alcohol, nicotine, and caffeine. What are illegal drugs? They are those whose use is unlawful. That means that is banned by the laws of the country, like marijuana, opiates like heroin, stimulants like methamphetamines and cocaine, and hallucinogens like cannabis and lysergic acid or LSD. Now we come to the prevalence of menace of drug abuse. That means how much this drug abuse is present all throughout the world. Now the picture is quite grim if the world statistics on the drug scenario is taken into account. With a turnover of around $500 billion, it is the third largest business in the world next to petroleum and arms trade. According to a 2015 World Drug Report of the United Nations Office on Drugs and Crime, that is UNODC, it is estimated that a total of 246 million people, that means slightly over 5% of those aged 15 to 64 years, used an illicit drug in 2013. 27 million people are problem drug users, almost half of whom are people who inject drugs in themselves. If we talk about India's population, we find ourselves uniquely placed between the Golden Triangle, which composes of Myanmar, Laos and Thailand, and the Golden Crescent, which is composed of Afghanistan, Pakistan and Iran. These two regions, that is the Golden Triangle and the Golden Crescent, produce the vast majority of the world's opiates. According to estimates, there are approximately 70 million drug abusers in India. DAMS, that is Drug Abuse and Monitoring System data, amongst men found that most commonly abused substances were alcohol, that is 65%, and then opium and its derivatives, heroin, other opioids emerged as the second preferred drug category. If we look at the data of India, I have gotten this data from the Lok Sabha. It was presented in the Lok Sabha on December 9, 2014, where Mizoram tops the list of states where drugs were seized. Almost 48,209 tons was caught over there over the past 4 years, followed by Punjab with seizures of 39,064 tons. So Mizoram, Punjab and Manipur are among the states where people are most vulnerable to drug abuse. One reason could be their proximity to the porous international borders and international drug trafficking zones. The drugs seized include amphetamines, cannabis plants, cocaine, ephedrine, ganja, hashish, heroin, ketamine, lysergic acid diethylamide, that is LSD, acetic anhydride, methylene dioxy N-methylamphetamine, that is MDMA, methamphetamine, which is also called as meth, then methaqualone, that is mandrax, morphine and opium. The figure for all of India is quite grim. Now moving on to the number of cases reported, as many as 64,737 drug trafficking cases have been reported in the past 4 years. Punjab tops the list with 21,549 cases registered over the same period. Punjab accounted for almost half of all cases registered in India under the Narcotic Drugs and Psychotropic Substances Act, that is NDPS, in 2013. 67% of rural households in Punjab have one drug or alcohol addict, while 70% of young men are addicted to drugs or alcohol, according to a government report based on surveys. In Manipur, there are estimated 45,000 to 50,000 drug addicts, of whom nearly half are injecting drug users. So, every third male and every 10th female student has taken drugs on one pretext or the other, and 7 out of 10 college going students abuse one or other form of the drug. If we look at the data or the survey, that is the Punjab Opioid Dependency Survey or PODS, we can see that before 2000 it was largely opium addiction. When we look at the data of 2007, almost 90% addicts were using pharma drugs, and if we look at 2012, 50% addicts used pharma drugs and 50% heroin, and from 2015 onwards 90% of the addiction was heroin based. Now come to the drug abuse problem in Punjab. The National Drug Dependence Treatment Centre at the All India Institute of Medical Sciences, along with the NGO Society for Promotion of Youth and Masses, recently released the results of its 2015 study on drug abuse in Punjab, which threw up some alarming statistics. Not only were drug addicts found to be spending up to rupees 2.5 crore per day on the purchase of drugs, but the numbers of addicts were much larger than had been highlighted by earlier studies. The Punjab study discovered that from a population of approximately 27.7 million people, around 2.3 million people are opioid dependent, around 8,60,000 people are estimated to be opioid users, and more than 1,23,000 people are heroin dependent. It also found that drug users are getting younger. The largest number of addicts are in the age group of 18 to 35 years of age. Over 7,500 crores worth of drugs is consumed on an annual basis in Punjab. The money spent on heroin abuse is calculated to be a whopping 6,500 crores. Two kinds of drugs are presently being used in Punjab: opiate drugs, which are derived from opium plus synthetic, and pharmaceutical drugs, which fall under the category of psychoactive substance abuse. Even if we look at alcohol, the yearly consumption of alcohol in Punjab is touching 330 million bottles, making it one of the highest per capita consumers of alcohol in the world. After the statistics, now let's talk about drug tolerance. What is drug tolerance? Tolerance is defined as a person's diminished response to a drug that is the result of repeated use. So when a person uses drug repeatedly, the response in the person's body is diminished or reduced. So people develop tolerance to the drugs, and they have to take consecutively higher doses of drugs to get the same response. People can develop tolerance to both illicit drugs and prescription medications. Tolerance is a physical effect of repeated use of a drug, and it is not necessarily a sign of addiction. For example, if we talk about patients who are suffering with chronic pain, they frequently develop a tolerance to some effects of the prescription pain medications without developing an addiction to them. There are three main types of tolerance if we talk about. First is the acute or short-term tolerance, which is caused by repeated exposure to a drug over a relatively short period of time. Cocaine abuse often results in acute tolerance. Experiments have shown that after a first dose of cocaine, test subjects experience a euphoric high and an increase in heart rate and blood pressure. However, despite nearly doubling the levels of drugs in the blood, a second dose of cocaine 40 minutes later does not result in a dose-dependent increase in the positive effects of the drug. So it does not produce the same result. The second dose doesn't produce the same result as compared to the first dose. This is called as the acute type of tolerance, and it is very short term. Next is chronic, which is a long-term tolerance. It develops when an individual's body adapts to constant exposure to a drug over weeks or months. People who regularly abuse prescription opioids build up chronic tolerance to the euphoric effects of these medications, leading many of them to increase the dosage or switch to more potent ways of taking these drugs, such as snorting or injecting. So if a drug is taken over a long period of time, slowly your body becomes tolerant to the effects of the drugs, and the person that is taking the drugs to experience the same high has to take a larger dosage of the drug, or has to take it by newer methods like snorting or injecting, so as to get a higher response to that drug. The third type of tolerance is learned tolerance. This may result from frequent exposure to certain drugs. For example, people who abuse alcohol for months or years often do not appear intoxicated to others. Experimental studies have shown that drinkers can compensate for the effects of alcohol on their coordination when they practice a task repeatedly while under the influence. However, this tolerance disappears if the task is altered. So suppose a person is taking alcohol regularly and is doing a task after taking alcohol. With time, because he is repeatedly doing that task, he will become tolerant to the effects of alcohol just in case of doing that task. However, if the task is changed, this tolerance disappears. Finally, most drugs have more than one effect, and tolerance does not necessarily develop equal to all the effects. The abusers of illicit and prescription opioids such as heroin or oxycodone, oxycontin quickly develop tolerance to the euphoric high these drugs produce, but not to the dangerous side effect of respiratory depression, that is the slowed breathing rate. So abusers may become tolerant to one of the responses of the drug and do not become tolerant to the other, as in the case of oxycontin, where abusers develop tolerance to the high of these drugs, but they don't become tolerant to the bad effects or the dangerous side effects of the drugs, like slowed breathing rate. Opioid abusers who take large doses of these drugs to overcome tolerance and get high are frequently hospitalized or even die, because there is increased respiratory depression, or their breathing rate is so slowed down that they ultimately stop breathing.